Et si nos professionnels de la santé tombent malades, ils ne peuvent pas aller vous soigner si vous tombez malade. Notre pays fait face à la de son histoire. Nous ne pouvons pas mettre à risque les gens qui nous gardent en santé. Et ceux qui s'obstinent à voir leurs amis ou à recevoir des gens à souper mettent tout le monde en danger. Les épiciers, les techniciens d'électricité, les chauffeurs d'autobus, ça. On doit les protéger. C'est pas compliqué ce qu'on vous demande. Restez chez vous. Si vous devez absolument sortir, gardez une distance de 2 mètres les uns des autres. Et si vous revenez d'un séjour à l'étranger, rentrez directement chez vous et restez là pendant au moins 14 jours.
And welcome to today's media briefing. We want to thank our media partners for participating in these regular briefings and assisting us with sharing this important information about COVID-19 in the community. Joining us today is Acting Medical Officer of Health, Dr. Shuli Wong, who will provide an update on local cases as well as a process change. We will then hear from Region of Waterloo, Mike Murray, who will provide some key regional updates. I will now turn it over to Dr. Wong.
Thank you. Good morning, and thank you for joining us. So as Julie mentioned, I'm going to talk about a change in decision about the public exposure page that we mentioned on Monday's press conference, and then an overview about cases in our region. Regarding the public exposures page, on Monday we announced that we would post locations where we knew cases had visited when they were symptomatic and may have interacted with people whose identities we didn't know. Although we thought these were likely low-risk situations, the goal was to try to keep our community informed. That said, the situation has evolved very rapidly, including in the last couple of days, such that it no longer makes sense to try to maintain such a page. This is because the most appropriate advice I have for the community now, based on the latest information we have, is that the risk of acquiring COVID-19 is present across the region. So it no longer makes sense to identify specific locations which could disproportionately single them out, as well as lead to a false sense of security for people who were not at those locations. Now I'll talk about the overall case situation. And I wanted to highlight that in the last 48 hours, the number of cases has risen significantly. In total, we now have 58 cases in the region as of 10 a.m. this morning. Of the 58, 25 are confirmed positive and 33 are presumptive. 11 cases are currently in hospital. The total number we have tested in Waterloo region is 1,231. Of that number, 770 have been confirmed negative. We are awaiting test results on 403 individuals, and public health is monitoring 461 people. Regarding St. Mary's High School, among our newly reported cases are 2 cases who are members of St. Mary's High School community. There is no clear link with one of the 2, and for the other one, it's difficult to be certain whether it was due to transmission from the first case or not. It could have been through acquisition in the community. That said, school is out. To St. Mary's school community is not significantly different now to that of our community overall. While we sent out yesterday a second set of letters to members of the St. Mary's school community who may have had potentially low-risk exposure, it will be the last set of letters we will be sending out. Earlier, the circulation of COVID-19 in our community is such that it is no longer possible to know for sure whether people acquired it from a known case in such a setting or elsewhere in the community. For almost all of our most recent presumptive cases, there is no link to a previously identified case. In closing, given the rise in cases, including in the last 48 hours, it is my recommendation that residents should act as though COVID-19 is circulating in the community and across the region. Wash your hands, stay at home if you can, especially if you're sick, even if you are mildly sick. If you don't need to be out, don't go out, or only go out to buy essential supplies. And when you're out, please practice social distancing. I recognize that it is a difficult time for our community, and I really want to thank our community for everything they're doing to help us slow the spread of COVID-19. Thank you, and I'll now pass it to Mike Murray.
Well, thanks, Dr. Wong, and yes, thanks again to our media partners and the community for all your support. As you may have heard this morning, Regional Chair Karen Redmond declared a state of emergency for the region of Waterloo as part of the region's ongoing response to the COVID-19 pandemic. Chair Redmond provided her media update earlier today and responded to media questions and answers. So I'm providing this update on behalf of the region and on behalf of the Pandemic Control Group. So I'm going to cover a couple of things. First, the emergency declaration. And as Chair Redmond said in her statements this morning, the declaration is not meant to cause panic. It's meant to be used as a tool to help us stop the spread of COVID-19 and respond quickly to the events that will likely arise in the weeks ahead. Declaring a state of emergency increases the ability of the region and all the area municipalities to share resources, staff, and equipment that are needed to support the broader public sector and key services. It also allows us to easily deploy and support volunteers to help provide critical services if that becomes needed. We hope the declaration sends the strongest possible message to our residents. As Dr. Wong said, COVID-19 is circulating in our community and anyone can get sick. We're asking everyone to stay home, stay safe, and only venture out to buy essential supplies. On behalf of Chair Redmond, I also want to take a moment to thank all our emergency professionals, police, paramedics, and firefighters for coming together as essential partners and continuing to provide critical services during these challenging and uncertain times. Again, on behalf of Chair Redmond, I want to send an important reminder to citizens about the appropriate use of 911. Please do not dial 911 in an attempt to jump the queue and get tested for COVID-19. We've heard of several instances of people trying to take this approach. It is a misuse of our valued resources and it places first responders at risk. So please only dial 911 in true emergencies, and if you do so, be honest with the first responders about your potential exposure to COVID-19. I'm going to add a couple of other things in terms of regional updates. One related to economic support, and then I'll touch briefly on the opening of a temporary shelter and some waste collection changes. So in terms of support to our local businesses during the pandemic, as expected, and as we know, there's an extremely high level of uncertainty right now. Many municipalities across Ontario have been working together to put in place financial assistance measures. To provide some financial flexibility to residents and businesses of Waterloo Region, the Regional Council yesterday in our council meeting approved first steps down this path, and the first steps include the following: waiving late payment charges on regional water and wastewater bills for the months of April and May, waiving NSF fees on customer accounts, suspending water shutoffs and collection activities for April and May, and this is in addition to measures, similar measures being considered by local municipal councils with respect to property tax bills and waiving late payment fees. And I think all of these reports to regional council and area municipal councils emphasize that this is just the first step. We continue to monitor things and will continue to bring forward further recommendations as needed. I'm now going to turn briefly to the opening of a temporary shelter. As we've talked about, one of the ongoing challenges in the pandemic response is ensuring that marginalized people in our community are well looked after during the pandemic. So, as a result, the region and our community partners are taking action to protect the most vulnerable people from COVID-19 and ensure they have a safe place to stay around the clock. As part of the Community Support Control Group's pandemic response, the A.R. Kaufman YMCA in Kitchener is being modified to serve as a temporary emergency shelter. The shelter will provide access to amenities, including shelters. The shelter will be open later this week, likely Thursday or Friday. It will initially accommodate people who are now accessing the St. Mark's overflow shelter space, and it will have capacity to serve overflow from other shelters once additional staffing is put in place. So again, this is just part of the ongoing efforts to ensure marginalized and street-involved people in our community are well looked after during the pandemic. So that was shelter response. I'm also going to talk a little bit about some changes that the region is making to waste collection, again, during the pandemic. So like many other service areas, waste collection is challenged to maintain appropriate staffing levels so we can continue to provide waste collection services. And to help reduce the burden on our essential frontline waste collection crews, we are making some changes to curbside collection effective Monday, March 30th. So here are some of the changes, and all these will be on the region's waste management website. So some of the changes: yard waste collection will not start as scheduled next week, and yard waste will not be collected as garbage. Similarly, bulky and large item collection will not essential, and therefore residents are currently a limit of 4 bags or containers for garbage every other week, and we're increasing that temporarily from 4 containers to 6 containers every other week. And this is to assist residents who are unable to drop off diapers at the small vehicle transfer station, and to allow anyone who is sick to put recyclables who have touched their face into the garbage. Small apartments will also have their limit increased from 10 bags to 12 bags. Further on waste management, many of our waste management facilities are closed to the public until further notice. This includes the temporary closure of our small vehicle residential drop-off transfer stations in Cambridge and in Waterloo. The Waterloo and Cambridge waste sites are still open to accommodate our curbside collection contractors, as well as to accommodate commercial and small business customers who are still operating essential services. All sites are fully closed on Saturdays until further notice, and alternate private sector waste drop-off facilities are available for critical services, and critical information is available on the Waste Management website. So those are a few updates on behalf of the region, the Pandemic Control Group, and we'll open it up for questions.
Thank you, Mike. So first up for questions is Brian Burke from 570.
Dr. Wong, I've looked around at some of the numbers from across the province, and the region seems to have higher numbers both in confirmed and in pending. And I'm just wondering if there's a reason for that compared to other places like London and Ottawa. Is it quite simply a matter of testing, or is there something else to be inferred there?
Oh, hi, Brian. Yes. So our sense when we look at the numbers is that we're actually in line with what we're seeing in terms of increases. The numbers that we post may not be the same as what's being posted elsewhere. We may not be the same way. For example, these things get updated regularly by the province and other areas. We, as of Monday, started announcing presumptive cases, for example, and the province at that time at least. And so what we're seeing actually, in my estimation, what we're seeing elsewhere and what we've seen happen in places like Toronto, for example, a little earlier, it's true that it doesn't actually, cases don't rise at the same time across the entire province. There's it kind of depends, or it's very roughly in line with the size of those municipalities. And I think we're in line with the size of our municipality.
If we can go back just for a second to that, to the list of possible public exposure, was there something about those two locations that prompted that list to come out and then very quickly be shut down?
We were finding, as we were getting more cases, we were getting more indication of public places where cases were symptomatic. And before, when we had less cases, we were able to usually be able to identify who the cases were in contact with when they were symptomatic. For example, when we had travel-related cases, or mostly travel-related cases, we could identify a travel link, a link with someone who had traveled, and the circle of people that these we got more and more reports of places that they had been public about, you know, we should keep the community informed. But that's because at that time, there was still a limited number of places that we could identify and say, well, somebody who had the symptoms of, who was diagnosed with COVID and was symptomatic was there. Now, with the rapidly increasing number that we have seen, including the last 48 hours, now we know that there are multiple places across the region where people who had COVID-19 were symptomatic. It's likely to be low risk if it's in a general setting out in the public, because the risk is still highest for those who have close, prolonged contact. But it no longer makes sense now to signal out specific locations. And when we were posting just for a day, there was nothing in particular about those locations that isn't shared now with all locations across the region.
And last question, with the declaration of an emergency, are there more tools in your toolbox to reduce the number of people who are out and about? It's less than it was before, but you know, for somebody who, I drive to one place every day, that's it. Mm-hmm. It seems to be a significant number every day. Is there more that you can do as the medical officer of health?
There isn't. It doesn't give me more powers. I already have a set of powers, but it does give the region and the municipalities more power. So I fully support the declaration. I think it was the right decision at the right time.
Thank you, Dr. Wong.
Thank you.
Thank you. Okay, next up, Kate from CBC.
Thank you. This question is for 911 calls. I'm wondering if you have a sense of just how many people are calling 911 to...
No, I don't have a sense of that number. We have heard anecdotally from our first responders and 911 call takers that some people appear to be doing that. And that's really why we wanted to make this comment today and really to urge people to use 911 appropriately. So I don't have a good sense of how prevalent that is. I can't imagine it's very prevalent, but it 911 or our emergency first responders.
And for Dr. Wong, I've seen a lot of people online who are saying, oh, I want to sew some surgical masks for people, and who do I donate these to? I'm wondering if public health has any kind of guidance for people who want to do something like that but don't really know how to go about it. Like, should they be doing this thing?
Yes, we know there's healthcare organizations and agencies like Ontario Health and Ontario Health West, which covers our region, that have set up sort of central, channels for which people can submit their offers of donation. And there's also one that the local hospitals have set up. So I'm actually going to, ask our communications team if they could perhaps send that to the press later, because I don't have it off the top of my head in terms of the actual web links and things like that. But yes, it's being now centrally coordinated through multiple channels.
Okay, and I'm just wondering, I know that we had cases where some people were tested at St. Mary's Hospital in Kitchener.
Yes.
Wellington, Dufferin, Guelph Public Health told me that one of the healthcare workers from Guelph General is from Waterloo region. Do we have any sense of just how many healthcare workers are on the list of potential cases?
That's a very good question, Kate. We are really focusing our testing on healthcare workers and people in hospitals and people like that, right? And so more and more what we are going to get are results of positive cases among healthcare workers and among those in hospitals. That doesn't mean that it's because those settings have greater risk. In fact, there are stringent protocols in all our hospitals to reduce the risk and to protect patients and other workers. What it means is that we are having good intelligence now on, who is testing positive in those environments, so we can continue to put in place the appropriate precautions in those environments. So I don't have off the top of my head exactly, how many are healthcare workers on that list, because the list is being updated so quickly and the results are coming in so quickly. But I can confirm there are definitely healthcare providers on that list, and that's what we're going to see more and more of.
Okay, thank you very much.
Thank you.
Okay, next up is Joanna from The Record.
Thank you. Dr. Wong, I'm just wondering if you could tell us more about the 3 cases that are in people under 20. Those are the first ones that we're seeing here locally that are that young.
Yes, absolutely. So it's not unexpected. We know this can affect anyone in any age group. So we do have 3 under 20 currently. It's not a surprise. Not sure if there's. Yes, go ahead.
And those were all from close contact?
Yeah, those cases right now, those particular cases are all from close contact, correct. But, more and more cases that we're seeing don't have a contact with a known case. So that could change over time, just like with the other age groups.
All right, that was my only question.
Okay, thank you.
Okay, Adam Jackson from Waterloo Chronicle. Adam, are you there? Okay. All right, we'll move on to Nicole Lampa from CTV.
Hi, this is for Dr. Wong. Just a follow-up question in regards to those listed under 20. Can you clarify how old those 3 are? Are they babies, children, teenagers?
We're not going to be releasing that specific information. We're just saying that they're under 20.
Okay. Now, last time you said there's a high likelihood that the presumptive cases will become confirmed cases. Just wondering if you can provide us with a percentage and what happens if a test that was deemed presumptive comes back negative. How will this be reflected in the update?
Yes, that's a good question. So what we're seeing right now in our region as well as elsewhere in Ontario is that the presumptives are coming back confirmed, but they're coming back confirmed, a few days later, like 5 days later. So that's why we can't wait to see them confirmed before we act. So far in our region, all the presumptives have come back confirmed when they come back. And if it's no longer, if it turns out that one of the cases may come back to be, finally not COVID, well, then that just means that the precautions that have been put in place for those people no longer apply. But the vast majority, I expect the vast majority will come back as confirmed.
Okay. We're hearing about concerns of a shortage of tests in the region. If there is it as a result of shortage in test kits or shortage in staff who can administer them? And why isn't everyone being tested?
Those are good questions. So the limited supply that we have in the region is totally what we are seeing across Ontario and Canada. So it's not our region that has disproportionately less supply. It's the case across the province and country. And what we are doing now in this phase of the pandemic is focusing in on testing those people for whom the test can actually change the course of how we treat them or how we manage them. If you have mild symptoms and can recover at home, it doesn't matter whether you test positive or not. The result and the recommendation is the same for you. Whereas if you're in a hospital setting, it could change the treatment that you get. If you're a healthcare worker, it can change, whether or not you can work. So that's why we're focusing in on those populations And as time goes on, as the pandemic continues to evolve, testing everyone and trying to find everyone becomes less and less important. It becomes more and more important to test those specific groups that we are now focusing on testing, and also to practice social distancing. Social distancing is going to be significantly more effective at helping to slow the spread than trying to track down all the cases and potential contacts. As we're seeing, it is becoming increasingly unlikely for us to be able to pinpoint where someone got it exactly, and therefore the measures that we would enact for that becoming less and less effective. But social distancing, on the other hand, is very effective. So I hope that helps provide some context.
It does. And finally, this is for Mike Murray.
Yes.
We're hearing that some regional workers potentially may be getting laid off due to this. If so, how many and what departments are they in?
Yep, so I'm curious where you're hearing that. So I would say one of the things that the region, all the municipalities, and frankly every organization just continues to look at is what are our critical services? How do we provide our critical services? How do we look after our people? And we just have to continue to evaluate who's at work, who's working from home, and what are the status of other people within the organization. So that's something that we'll continue to monitor. We continue to look at options. We're continuing to try to work with all our area municipal partners so that we treat our employees in a consistent way. So it's an ongoing effort to look after our people and manage the resources that we've got and manage the region's affairs prudently.
Okay, can I ask one more?
Sure.
Okay, this is, I guess, in regards to the community exposure location, we understand, obviously you explained why you're no longer putting those locations up, but one of the locations, the first one that you suggested yesterday, has posted online saying that the post came as a shock to them. Is there any retractions or anything like that that Public Health wants to say in regards to the first location that was named?
Yes. So it was my understanding that the owners of that establishment would be informed before the posting went up. Unfortunately, that was not the case, and I'm very sorry about that.
Okay,
we have reached
all.
out.
Thank
We
you.
have reached out to the owner. Thank you.
Okay, just a couple more on the list. We have Steve from Woolwich.
It's a question for Dr. Wong. Specifically out here in the townships, there are concerns with the Mennonite community, both getting the message out to them. And,
Steve, can I get you to repeat a little louder, please?
Sure. Let's try this. Any better now?
Yes.
Okay. I was just looking for some information on, in terms of what contacts have been made for the Mennonite community and the provision about them. There's been some concerns about them adhering to the social distancing guidelines that have been set out.
What was his name? Sorry.
Steve.
Hi, Steve. So this is Dr. Wong. Hello. So we are working with Waterloo Region Police Services, who is part of the Rural Realities Network, and the rural officers have reached out to the Old Older Amish and David Martin community, and we understand the Old Older had a conference call on Thursday, and they suspended all church services. Sergeant Gibson from the regional police also mentioned that she has been in contact with Community Health Center, and they have reached out to other groups as well. And we are aware that the townships have also done some of their own communications to the Mennonite community. We really encourage all our communities to stay informed with what's happening, and if they would like some more information from us, we are happy to connect with them and provide them more information.
Sort of a segue from that, then, specifically to this group, although it may include that. I'm just wondering what types of enforcement may have occurred at this point at any location in the region in terms of exercising some of those heightened powers.
We have not felt that there was a need we have not felt that there has been a need to date to apply enforcement. We've found that in many cases, having conversations with people, reaching out, providing information has led to compliance. Really, the goal is not enforcement, but compliance. Enforcement would be a last resort, or if we felt that there was a significant risk and there was really no desire to comply. In those cases, we do have a very collaborative relationship with Waterloo Regional Police, and we will act if necessary. At this point in time, we've been finding that what people are needing is more information and really a greater awareness that this is really important right now. This is not optional. Everyone needs to do what they can, and we really appreciate that people have been doing that. By and large, they've been doing that. And we have very few cases where we feel that, okay, we need to do them. We need to go out and speak with them more. And we are doing that, and we are monitoring. We do get complaints and things like that, so we are monitoring and we are following up. But again, our goal is compliance, not enforcement if we don't have to.
So no enforcement measures or fines to this point then?
No.
Okay, great. Well, thank you.
Thank you.
Okay, can we hear from Kevin Nielsen at Global? Kevin, are you still on the call? All right, is there anyone else from our media partners that we may have missed? Okay. Well, with that said, we want to thank our local media partners again for helping us to share updates and information about the COVID-19 situation in the community. And for now, this concludes our thing.
For children. Please visit uniceflegacy.ca.
Ben Strasser here, Think Millennial, 9 p.m. Thursday nights. Join us on Rogers TV and our
Union is the only way forward.
No, Monsieur Cartier. Confederation will cost French Canadians their nationality.
Monsieur, together we will form a political nationality independent of our origins.
Diversity will be Canada's strength.
Then he fought for Manitoba.
The Northwest has formed a government under Louis Riel. We will not join Confederation unless our rights are respected.
So you want a new province? Then you'll have it. There will be a place for your people in Canada.
He envisioned a country from Atlantic to Pacific.
British Columbia won't even think of joining Canada without a wagon road through the Rockies.
Ask for a railway. We are building a country, after all.
Bold as a lion, Confederation could not have happened but for him. Le Canada, son pays, ses amours.
welcome back. Before we went to break, we were talking about the operating system. Let's look at the parts of the computer that you're going to need to use the most. So once your computer has finished starting up, the first thing you'll see is the desktop, and this is the area that you can see with this lovely background. You can think of the desktop as the main workspace for your computer, and from here you can view and manage your files, open applications, access the internet, and much more. But there are a few parts of the desktop that are important to know about, and it uses basically the same terminology for both Mac and PC, so we're going to talk about this. The desktop background that I just talked about, this is the background or wallpaper. You'll often hear it referred to as wallpaper. You can personalize this. You've probably seen people using their computer and they've got their own photos, their family photos, or their favorite vacation place. There are also some built-in backgrounds that the operating system offers, this is one of those built-in backgrounds. In Windows 10 and earlier versions of Windows, aside from Windows 8, the Start button is where you'll access all of your applications. When you click on it, it opens, and then you can select whichever application you're looking for. It will start to categorize the things that you use most often, because it's a little bit intuitive that it thinks that you'll maybe want to see those again. So it starts to move things to the top that you've accessed earlier. The taskbar at the bottom contains shortcuts to applications, the date and time. When you open a program or file, it will appear in the taskbar, and you can easily switch between different programs by selecting them on the taskbar. And when I open a couple of programs, you'll actually see how that works. Date and time settings are over to the lower right corner. You'll be able to change the date and time if you need to. It will also give you shortcuts to accessing internet connections, your volume settings, and you can see your battery power. Shortcuts on the taskbar are links to applications that you want to access quickly, so you can drag them down there and then you can just click on them. A single click will open them. It's different from opening them on your desktop because it requires a double click to open them. So it just makes it a little bit quicker for you to access the applications that you're looking for. And then of course there are folders that you can have on your desktop. These are applications. I don't actually have a folder created on the desktop, but you can easily create folders with a right click. You can just create a new folder, and that's what a folder will look like right on your desktop that you may have stored in that folder. So for Mac, there are a few parts of the desktop that are important to know about. The top left corner, the Apple icon, which you can click to access system preferences, recent documents, and other features. This is also where you can shut down your. The menu bar will contain different menu options depending on the program. This allows you until you click in the top right. Launchpad allows you to see a list of all of your applications. It's designed to make it easier for you to find and organize them. So this is where you can see that graphic user interface in action. All of these applications have a lovely little graphic icon to make it easy for you to find them. Across the bottom is the dock. It contains shortcuts to applications, files, and folders. If you have multiple programs open, you can use the dock to quickly switch among them, just the same as we talked about with the taskbar. So I'll show you how that looks when we start to open programs. And then you have the trash. When you delete a file, it's moved to the trash, and it moves to the trash to allow you the opportunity to change your mind. If you decided that you didn't want to delete that file, you can open the trash and retrieve it and send it back to its original location. Or if you do want to permanently delete it, then you just have to empty the trash. And when you open it, there's a little function that you can say to empty the trash. Whenever you open a file, folder, or application, it will appear in a new window, and you can have multiple items open at the same time in different windows. You'll use Windows all the time, so it's important to know how to switch between open windows, how to move in windows, and how to close them when you're done using them. You'll see the same 3 buttons, so I'm going to open Microsoft Edge, and I'll show you the different parts. So this is what we call a window, not to be mistaken. And time you're accessing any sort of an application, whether it's on a Mac or a PC, the view that you see will be called a window. Parts of the window, you'll see the same 3 buttons at the top of the window on a PC of every window that you're going to use. Have this little dash that looks like a minus sign. This actually means you can minimize the window. And then it goes down into the taskbar, as I mentioned earlier. But if you want to reopen it, you just click right back on that icon and it relaunches that window. Up here you've got 2 little squares. When you click that, it will just restore it down to a smaller size. And then you can click it open again to make it a bigger size. So if you wanted to have a couple of things open on the screen at the same time, you can have them smaller and then it's easier to switch between them. You can open that again. There will always be an X in the top of the corner. This will always mean close. So anytime you have a window open, there will be an X available so that you can close it. And then you just click the X and it disappears. So for Mac, you'll see the same 3 buttons, but they'll appear in the upper left corner of almost every screen. And clicking the red button again will close any window. As soon as you hover over it, you'll see a little X appear. Clicking the yellow button will minimize the window. So when you hover over that, you'll see a little minus sign, very similar to the PC windows. And then the green button is the button that you can resize the window, so you can click on it and it will make it full screen, or click on it again and it'll resize it and it may be half the screen. So we're going to take another quick break, and when we come back, we're going to look at applications. See you right back here.